Hi everyone, I'm Dr. Toor from Amplify Eye Care here in Olympia, Washington, and today we're going to answer the question of how often should you get your eye exam done or your eyes checked. So just to kind of start off, in a normal eye exam and with regular eye care, we not only check your vision and need for glasses, but we also monitor your ocular health, monitor any eye diseases, allergies, infections, your eye movements and your motor skills, and we can also follow along and treat certain neurological deficits as well. So usually starting from when you're first born, in that first year of life, between most of the time 6 to 12 months, it's a good idea to get the eyes checked of the baby at least once to kind of screen for any of the bigger eye diseases and problems that can occur. And then usually in the next few years, we can space it out. It definitely doesn't need to be every year unless there's something that's being watched. But usually at least once before starting school, a child should have their eyes checked as well to make sure that there's nothing that's going to be holding them back in school. And then after that, kids under 18 usually get checked every year, especially if they have glasses. But again, that can be changed a little bit depending on if there's something that they're being watched for, or if they don't have glasses, then we can spread it out a little bit further. And then usually between 18 to 65 is acceptable to be managed every 2 years or have your eyes checked every 2 years, unless of course you're having some problems with them. And then after 65, it's usually back to every year, just to make sure that there's no changes, especially in eye health at that point. And like I mentioned, all of this is just general, especially if you have any certain eye diseases like macular degeneration, glaucoma, diabetes, and so many other things that can vary your timeline of how often you need to get your eyes checked. But those are the kind of the general big rules there. And of course, if in between the times that you're waiting for your eye exam, if you start noticing certain changes in your vision, like floaters, flashes, sudden onset of blurriness, double vision, things like that, especially when there's sudden changes, you definitely want to come in sooner than your annual exam to get that checked and looked at, make sure that nothing else is going on. All right.